mentioned, I'm Denise Goten. I'm here from the Industry Labour Services part of WorkSafe BC. Sorry, I'll stand in front of the mic, is that better? And at WorkSafe BC, we have a vision for British Columbians to be free of occupational injury, disease, and death. And as an occupational health and safety professional myself, that very much resonates with me, and so I'm very happy to have been invited here to talk about safety and to participate in this collaborative, and really encouraged to hear a lot of talk and acknowledgement about safety. So I'm looking forward to the workshops this afternoon and dig into that a little bit deeper. Okay, there we go.
You're going backwards.
It seems to be, yes. There we go.
The other arrow.
There we go. Thank you. So when we look at healthcare workers represent over 11% of the workforce in BC. And when we look at the total time loss claims, they represent about 18%. So there's a bit of a disproportionate percentage there. And in fact, in 2016, the healthcare sector has more time loss claims than any other industry. So safety being very important. This morning I'm here to talk more so about the community health, the home support services, and the long-term care classification units rather than the sector as a whole, but I'll kind of work back and forth between the two. And what we can see from the data that WorkSafe BC collects is we have seen a growth in the industries from 2012 to 2016. For example, in the community health support services, we've seen an addition of almost 100 employers registering with WorkSafe BC. And I'll just take time to highlight the last column there, the 5-year total for time loss claims in these different classification units. So 4,600 in the home health area and about 14,000, more than 14,000 in the long-term or residential care areas. What types of accidents are we seeing? So in both of these areas, we're seeing the majority of accident types of the time loss injuries coming from overexertion. So this is strains and sprains, generally at a point of care with patients. We've also got in long-term care about 16% of our claims from violence, and we also see that in home health. And if we take that step back and look at BC as a whole, violence is actually disproportionate. Violence in healthcare does represent about 63% of the stats or the claims in the industry. And so, as we've touched upon, the importance in talking about violence and prevention activities in the workplace is definitely key. In amongst all of our others, not to lessen the other types of incidents we have. As we see, about 45% are from overexertions. When we look at who's getting injured, we see that in both of these areas, our nurse aide, orderly, patient services associates, so largely a good proportion being care aides, are our highest percent injured. And actually, when we look at healthcare care aides in the province, they do have the highest number of claims in BC, which traditionally you might think as a construction worker or transportation, but it is this worker group. So what does that look like? What does that mean? So on this graphic, what we have are the number of time loss claims in 2016 for each of these areas, and the number of work days lost. So this is the total number of short-term disability work days paid in that year. And if you do some estimates around that, what that means is that approximately 140 workers in the community home support services are away from the job in a year due to injury. And when we do some equivalent estimating on the long-term care side, that works out to about 465 people. So we've got almost 600 people that are currently trained and in the industry that are being at home on claims. So how does that compare, or what does it look like over time? So the bottom line is the injury rates of all occupation groups, and so we see on average is about 2.2. So that's about 2 people out of every 100 that have had time loss claims. When we look at just home care, it's nearly double at 4.5. And then when we look at our long-term care, it is significantly higher at more than 8 people out of every 100 experiencing a claim in 2016. So I want to highlight it in the long-term care area that there is a downward trend. So that's what we're looking for. But there's definitely a lot of room to further invest in worker safety. So when we look at the topic today about safety and staffing and retention, there's the obvious direct costs, the claims, the insurance costs, in addition to the ethical costs of workers off of work. We want to invest in those effective return to work programs, getting our workers that have experienced an injury back into the workplace quickly. But we also want to have the eye out for prevention and all those indirect costs, particularly on things like staff morale. How are people feeling in their environment when they see a worker go off injured? When we look at things like potentially corporate reputation, and where there's going to be more jobs than what there are people applying to those jobs, it's the applicant's market in a sense, and a place with a strong, positive safety culture that's promoted and people are talking about is going to be appealing. And so at this point, I'll hand it off to Selena.